you suffering from a sensitive skin which occasionally flushes or blushes? You have very refractory acne which is mainly over the center portion of your face. You have broken capillaries and you have gritty eyes. If the answer is yes, then probably you are suffering from rosacea. Hello and welcome. I am Dr. Srabani Ghosh Zoha, Senior Consultant Dermatologist from Apollo Multispeciality Hospital, Kolkata. Today I am going to talk about do's and don'ts in rosacea. Rosacea is a chronic inflammatory disease. The exact cause we don't know yet, but it usually affects over 30. Females are most commonly affected, but if occurs in males, it can be very severe and often giving rise to thick nose or rhinophyma, because the process can give rise to subcutaneous edema which can make your skin thick and waxy. So how do you diagnose rosacea? The main features of rosacea are: you can have occasional flushing or blushing which leads to persistent redness of your face. Sometimes they are triggered by hot drinks, coffee, chocolate, cheese, then excessive smoking. All these can actually aggravate this rosacea flushing. The second point is the skin develops textural changes. There can be acne, which mainly over the center portion of the face. You can have open pores, and over the period of time your skin becomes thick and waxy. The third problem you can have is broken capillaries, which means the superficial blood vessels are visible. And last but not the least, your eyes can be gritty and there can be inflammation of the eyes, there can be scaling. So all these features are also part of rosacea. So how do we treat this condition? I want to emphasize that rosacea is very much treatable condition. You have to seek specialist help if you are suffering from all these symptoms, because if you don't treat yourself, the changes, once they happen, it becomes very difficult to reverse those changes. So how do we treat rosacea? First of all, we do give you some drug treatment which will control the flushing and this acneiform lesions. You have to have some photoprotection, otherwise the erythema or redness will be very difficult. You must avoid having those triggers like having hot drinks, spicy food, tea, coffee too often. Then we also give you some topical medications to control the texture of your skin. We use laser light treatment to control the redness or the erythema of the face, and usually the eye symptoms, they do get better with treatment, and if you are not getting better, it's always a good idea to consult an ophthalmologist. So if you are suffering from rosacea, skin care is very important. Since you have a sensitive skin, you should always use a cleanser which is suitable for sensitive skin. Photo protection is also another important thing you shouldn't forget. Use of moisturizer which are best on hyaluronic acid or glycerin or ceramide. This kind of moisturizer will suit your skin better. If you want to exfoliate your skin, please avoid alpha hydroxy acids. The beta hydroxy acids or BHA are better for rosacea skin. And also, while doing makeup, avoid foundation or oil based makeup. Do avoid using harsh brush. A beauty sponge will be a better option to dab your makeup. And last but not the least, do avoid over the counter remedies or the remedies that are advertised in the internet, because when you think that you are using plant based products or those Ayurvedic products which are innocuous for your skin, but believe me, all these products can have some pro-inflammatory material or chemicals which can react with light and actually harm your skin. So without consulting a doctor, you should not apply anything which can worsen your skin condition. Once again, I want to reassure, rosacea is a very much treatable condition. Yes, we can't cure, but repeated treatment might be required, but at the end of the day, your symptoms can be controlled and you can have a normal life. Thank you.